Participants of BTXCARES talks are fully vaccinated, wear face masks, and follow social distancing guidelines. During these segments, face masks are removed to provide clear messaging to the public. Our production crew continues to wear face masks and maintain social distancing during the filming of these productions.
Brownsville. I'm Michelle Jones, the city's epidemiologist, and welcome to BTXCARES Talks. And this is where we discuss those really important issues that are affecting our community. And as we all know, EMS and our fire department have been on the front lines of this COVID-19 pandemic, and they've really come out and helped our residents through the situation. We thought it was really important to kind of bring their story to all of you and to see how this is affecting them during this prolonged engagement with this pandemic. So to help us tackle this really difficult situation and this conversation, we brought with us Deputy Chief Pedraza and Mr. Jesse Casanova to discuss COVID-19 and how it's affecting our city. So welcome, Deputy Chief Pedraza. Jesse.
Good morning. Thanks for having us here.
Thank you so much for coming. It's really exciting to have you here. So for our residents who might not know what EMS is and what the fire department does and things like that, especially when it comes to the pandemic, do you mind telling us a little bit about yourself and your department?
Sure, absolutely. So my name is Cesar Pedraza. I'm the Deputy Fire Chief for the City of Brownsville Fire Department. And I've actually been working with the Brownsville Fire and EMS for almost 29 years now. Okay. My role is an administrative role, and Mr. Jesse Casanova is actually he's a true hero. He's a frontline worker who was, with the COVID experience 100%.
Okay.
My name is Jesse Casanova. I'm a firefighter paramedic with the City of Brownsville, Brownsville Fire Department. Been working here going on 3 years almost already, but been doing EMS for about 15 years now. So this is a unique situation we've been going through with the pandemic.
Thank you so much for everything that you guys are doing during all of this and for coming down into discussing it with us. So you guys have been at the front line of the COVID-19 pandemic, especially since the first cases have come to Brownsville. Will you tell us a little bit about your experience with dealing with this pandemic in the beginning and also what's going on now?
Sure. I can elaborate a little bit on the administrative side of it. So we had to adjust our protocols very quickly. We had to really adjust our mindset and get ourselves ready to deal with this pandemic. And as Mr. Casanova said, really unique situation in that we've dealt with communicable diseases in the past. We've gotten really good at disinfecting. We've gotten really good at treating sick folks. But we knew this was going to be long-term. We knew this was not going to be 1 or 2 weeks or 1 or 2 patients. And so administratively, working with our medical directors, working with our local hospitals, we needed to adjust our protocols, needed to make sure we had the equipment, supplies, personal protective equipment for the duration of the pandemic.
Like Deputy Chief Pedraza said, it's been a challenge because nobody knew a lot of information when the pandemic started. Like the public, as well as we were afraid of what the outcome was going to be and how deadly or not the virus was going to be at the time. And we found out real quick that it was very deadly.
Yeah. I can imagine how kind of daunting it is because you don't have, with the other communicable diseases, you know what you're to expect, how contagious it is, how deadly, and then here you're kind of going in blind and you still have to show up for work. So did you guys experience that? Was that something that you were?
Yeah, when it first started, some of my coworkers and I were kind of like, how should we treat this? I mean, people need the help. We still need to show up to those emergency calls. And, but we made it through. We adapted and overcame the situation. And the administrators got us PPEs, masks, disinfecting equipment. Gave us the opportunity as well after each call to disinfect the unit very well as ourselves to be able to continue to the next call, because there were still people having cardiac arrest, people having strokes, seizures, or heart attacks and whatnot. So we still had to deal with those patients as well.
And I think that's one thing that people didn't quite think about, that other health events are happening at the same time that the pandemic is. So I think it's great that you guys thought about those things and making sure that you're protecting those individuals also.
Yes.
So the current topic is kind of, we've got the new Delta variant that is out there and it's circulating within our community. For those that aren't aware, the Delta variant is actually 99% of all new cases within the state of Texas and throughout the United States. So it's here. That's generally what we're getting. And have you guys had to change any protocols? Are you handling this a little different, or did we kind of fine tune everything at the onset of the pandemic?
You know, I think there's always room for improvement, Ms. Jones, but I think we fine tuned our processes to the point when we did realize there was a new variant and even other variants that are showing up. We have our protocols, our responses, and I don't want to say we have them down pat, but we're very confident in being able to respond, treat our patients accordingly, and transport to the most appropriate facility. So the variant affected us very minimally. We did, even amongst our personnel, we did have a few positive cases, but we were much more prepared for it, both physically, psychologically, and even with equipment and protocols.
Wonderful. And you did mention like the hospitals and those types of dynamics. So we do know that fire and EMS have a really wonderful relationship with our local hospitals here in Brownsville. And do you want to tell us a little bit about how that dynamic works and what's going on with that collaboration?
Sure. So my dynamic may be a little different from Mr. Casanova's. However, I know that the Office of the Fire Chief meets with the local hospitals on a daily basis. Every morning they have a conference call, and that's to discuss the capacity in the emergency rooms, the ICUs, how many COVID patients are in there, and we adjust our transports accordingly. So luckily we do have that great collaboration, communication with the local hospitals.
Okay, so one thing that we do talk about is the vaccine, and there's a lot of people out there that are actually afraid to get the vaccine, or they're hesitant because they're not quite comfortable, or they feel they need more information. So what would you say to these individuals that are afraid or hesitant?
I can speak of my own personal experience, and I personally initially was a little hesitant to get vaccinated, and I think a lot of us were. And the final determination for me was I did this for my family and friends. You know, we may think that we're healthy and can overcome this virus, and chances are we can. However, I didn't want to take that chance with my friends and family. So the vaccine for me was to protect them as well as myself and my coworkers.
So when you're out there on your EMS calls, are you seeing vaccinated people, or are you this new wave, is it mostly among the unvaccinated?
I've seen both. Out in the field, I've seen both vaccinated and unvaccinated. But the vaccinated seem to be more just like a cold, a flu, fever, not too much. The unvaccinated is like low O2 shortness of breath, the chest pain, the whole body aches, and those are require oxygen or even ventilators at times. So yeah.
And in communicating with the hospitals, one thing that has been constant, especially during the new variant, is that I believe they were at about 90% of their ICU patients were unvaccinated. So that's really important to put out, I think.
Yeah, that's really astounding, because a lot of times people talk about the breakthrough cases, which are, you know, those that are vaccinated but catch the disease, but their symptoms aren't near as severe, so their outcomes tend to be better. And I think that's important for everyone to know, that you can still catch it, but the odds of you going in and being hospitalized, ICU, death, are drastically reduced. So thank you for bringing that up. So as we've discussed, this is a prolonged experience that we're having with COVID, and like you said, it's not a couple of days or a couple of patients or a couple of weeks. So there's a lot of stress dealing with individuals and trying to help people who are severely ill. So how has that affected your department and also those that are on the front line?
We've adopted some resiliency programs to include peer support programs. We have a chaplains program. We really rely on each other as a group, as an organization, to get through any event, whether it's COVID or just dealing with death and dying on a daily basis. And that's really been enhanced during COVID, in that we were making what we called care calls pretty often. And that was just checking up on our sick personnel, making sure they were okay, making sure they didn't need anything at home. So our organization, I believe, is stronger because of COVID. Again, we really leaned on each other. Some of our resiliency programs were really stressed and tested, but I believe we're in a better place because of them.
And how about you, Jesse? Have you noticed anything different, or how are you guys holding up?
I think the support we have for each other at the firehouse and the camaraderie, that's been excellent. So we've been handling it pretty good for the most part, yeah.
Often your services go unnoticed because when you're functioning well, you don't quite acknowledge what EMS and fire do for us. But on the behalf of the city, we'd like to thank you for coming out and doing all that you guys do, not only with each other, but also with all of the residents and even those individuals that might be traveling, because everybody gets treated so well by our EMS and our fire departments. So thank you so much for everything.
Thanks for having us, Michelle.
Thank you. And we hope the community found this information really informative and gave you that added insight into what EMS and fire are doing and how the COVID situation is affecting everyone within the city. We do know that you may need some additional information, so always go to cdc.gov, and we do have our COVID hotline, and you can dial that in at 956-394-0012. And make sure you check us out on our city's Facebook page and our YouTube channel. For BTX Cares, I'm Michelle Jones, the city's epidemiologist, reminding you to stay safe and to stay sanitized.